These are the final days of Breast Cancer Awareness Month. There's actually a law many women might not have heard of that helps survivors of breast cancer become whole again after a lumpectomy or a mastectomy. Dr. Todd Hicks is a surgeon with Premier Plastic Surgery, and he's live to talk about the Women's Health and Cancer Rights Act. Good morning.
Good morning.
Why do you think some women don't know about this? They're just kind of misinformed, or they're not really looking into all the resources out there?
Well, the act was actually enacted in 1998, so it's fairly recent. It's only been around for 16 years. So for a lot of women, they may not have been available when they were diagnosed with breast cancer. But the good news is that even now, if they are 10 or 15 years or 20 years out from the mastectomy or lumpectomy, they can still have reconstruction.
Wow, that's interesting. So if you had it before the law came about, you could still go back and maybe have that reconstructive surgery.
Yes.
And talk about the women that you see. How important is it for them to be able to feel whole again?
Oh, I think it's one of the most important things. Studies have shown that women that are undergoing breast cancer treatment, that they tend to have better outcomes, and they emotionally do better when they do have breast reconstruction. I mean, I'm confronted every day by women that said they don't know if they can go through this if they're not going to get reconstructed. So it's very important in their process.
And you could do what for them? If they get a lumpectomy or a mastectomy, you could basically kind of recreate what they would have normally, maybe even improve on it, right?
Correct. So, if women have a lumpectomy, sometimes they will develop an asymmetry. One side will be bigger than the other. We can make the bigger side smaller or the smaller side bigger. If they have a full mastectomy, then we can recreate a breast on that other side. Sometimes women who are smaller choose to be bigger in the end. Sometimes women that are bigger choose to be smaller in the end.
Yeah, it's basically a personal preference, of course. And when it comes to the insurance claims, what percentage of the surgery is covered, or does that depend on the provider?
It depends on each person's individual plan. So each person will have to pay their portion, their deductible, their co-pays, but their insurance is mandated by federal law to pay their portion of the procedure.
And you and I were chatting too, this also covers a prosthetic if a woman tries to go down that route.
Correct. There's some women that are not interested in additional surgery because it's more time off work, more healing time. If they want to have a prosthesis to wear, they can, that's also covered by the act as well.
And what if someone out there does want to go ahead and do this type of procedure that's had breast cancer? What advice do you have for them? Well,
the first thing is to always see, a board-certified plastic surgeon. That's the most important thing. In Dayton, we have lots of very good plastic surgeons. Start with seeing one of them. Or also talking to their general surgeon to make sure it's appropriate, at this time in their, healing process and their treatment.
Well, good information. Thank you so much, Doctor, for coming in. If you want more information about what we just chatted about, we have details on our website. Go to fox45now.com, click on Fox 45 in the morning.